In healthcare, it's very important to do great work. However, it doesn't stop at great work. If people don't see you, if they cannot trust you, and if the work you do does not make a difference, you will probably feel like you're stifled at your place of work. So let's break that down a little bit. There are 3 pillars I like to talk about when it comes to leadership readiness, and that is visibility, credibility, and evidence. First, let's talk about visibility. Visibility is how you're seen. Are you seen as leadership ready? Are you seen as impactful? Are you seen as moving the needle forward? A lot of times our training did not teach us to brag, didn't teach us to blow our own horns. We expect that the work we do will actually speak for itself. In reality, that is very far from the truth. Sometimes you really need to take on the responsibility of making sure that your work is visible. The second is credibility. In fact, most physicians don't have a problem with credibility, right? You've gone to school, you've gotten the degree, you've gotten the CME, you're board certified. All those things add to your credibility. So you show up, you're ready to do the work that you are trained to do. But when it comes to leadership readiness, it's important to not just acknowledge the clinical authority that you have, but make sure that your leadership authority is evident. So credibility, when I'm talking about it in this context, it's not just clinical credibility, but also leadership credibility. People want to know that you're just not a physician. You're a physician who's credible, who's reliable, who is able to think through complex systematic problems and solve it. Finally is evidence. A lot of physicians have results, but we have results that we've not yet translated into impact. The evidence really depends on who you're speaking to. If you're speaking to a patient in the community, right, they don't need to know that you saved the hospital $20 million per year, right? That's not the evidence you want to translate to them. What they need to know is that your patients are doing well, they're getting in on time, they're getting seen, they're getting examined, and generally you have a healthy panel. However, when you're talking to maybe the CEO of your hospital, how you translate the same result into evidence is different, right? You see patients, you get them healthy, you get them in and out. You also need to tell the CEO, though, that you're having cost-saving impact, you're having quality impact because of the great work you're doing. So you see how the same result can be translated differently, and that's what I mean by evidence. So let's sum it all together. What does that mean? Visibility is important. Credibility and evidence is important. And in fact, most physicians are credible and they have the evidence, but visibility is where they struggle. So if you're doing great work, but your work is really just hidden because you don't want to take credit for it, let's stop that today. The world deserves to know the great work that you do. So your degree is not a terminal point. It really is the starting place for your influence and impact.